Let me share it. Okay, I'm going to just transition into the slideshow here from the beginning. Okay, so I want to thank my colleague, Dr. Motivala, who's assistant professor at the Zucker School of Medicine also, and she's one of our neurosurgeons at Staten Island University Hospital. Um, just so that you're know, we do have several women attendings in our program. We have four female, oh, actually five, actually female neurosurgeons out of, I don't know, somewhere around 30 neurosurgeons. Uh, there's me, there's Dr. Motivala, there's Dr. Gilad. Both Dr. Motivala and Dr. Gilad are at Staten Island University Hospital. And then there's Dr. Liu over at South Shore University Hospital doing general neurosurgery. And then there's Dr. Pruitt, who was a resident graduate from our program, who also attended the Zucker School of Medicine, and she is a pediatric neurosurgeon. So we're are a great group, and hopefully over time we'll even have more women join our faculty. But we wanted to discuss what women in neurosurgery are. We're a little bit less than a minority, it's true. And so it's a field that we are actually breaking through quite robustly, actually even more in escalation over the past, I would say maybe 10 to 15 years than even when I was a resident. And I'll tell you a little bit about my story in just a bit. But the women in neurosurgery, as you could see, well, as you may know, we're fairly uh, rare or uncommon in the breed of neurosurgery, but it's getting less uncommon or rare. And I would have to say that we comprise of all board certified neurosurgeons in the country, we comprise maybe about 8%. So that's all the women that graduate from the programs and then get diluted into the broader field. We're about 8 to maybe slightly up to closer to 10% now. But what's really heartening is that approximately 20% of all residents are now women. So we've gone beyond the 15% that is required to be an official minority, and we are now beyond that. So I think women's interest in neurosurgery has been keen and growing in the last maybe 15 years, as I said, perhaps even more or less 20 years, and it continues to grow. I think because as we see that more and more women starting to reach prominence in the field, that it is possible to be a neurosurgeon and also to have a fulfilling life. So just we'll talk about some of those things as we progress with this session. So this is Sofia Ionescu. She was born in Romania in 1920, and she is really, I think she's really considered really the first female neurosurgeon. And she did a fifth year of medical school internship in the neurosurgical unit of the Central Hospital for Mental, Nervous, and Endocrine Diseases in Bucharest. And she did perform the first cranial surgery as early as 1944. So the 1954 marks her as becoming a specialist in neurosurgery. So this is a very important landmark for women in the field. As you may know or have known, that the first woman physician, and we celebrate women's physicians, is Elizabeth Blackwell, who was the first woman to graduate from a a legitimate, sanctioned medical school in the 1850s. So, at some point, those women that were just starting out were mostly relegated to do women's diseases, such as becoming essentially obstetrics and gynecologists. But as time moves on, we have more women becoming practitioners, general practitioners, and now reaching the surgical fields. Um, so the decisive moment here um, to shape her future was that Professor Bagdasar, who was unable to operate because he had a wound on one of these fingers. Um, she basically did the operation and saved the life of an 8-year-old. And so at that point, he was able to see and appreciate the fact that she was a skilled surgeon and leading his mentoring and support through the infancy of her career. So, yes, I guess under the circumstance, behind every great woman neurosurgeon, there's a man, because without men that were friendly and open, it would have been extremely difficult for anyone like Dr. Bagasar to make it into the field. So she then spent like uh, her remaining years as the head of cerebral tumors and the head of spinal pathology. And she actually pioneered a lot of technical advancements. And she was a wife and a mother of 2 children. So, as opposed to Elizabeth Blackwell back in the 1850s, made a decisive choice. She couldn't marry a man, obviously, because she's devoted towards a career, but she ultimately actually adopted a child so that she became a mother. So it's an interesting evolution, and here's an early neurosurgeon who had a family. So Diane Beck was an English neurosurgeon, also at the time, also being credited as being the first female neurosurgeon, so a contemporary, and established a neurosurgery service in England. And she had a 31-year career when she was the only female neurosurgeon in Western Europe and the United States. So these are our pioneers. Dr. Ruth Jacoby was actually the first woman to become a diplomat of the American Board of Neurological Surgeons, and this was in 1961. And some years ago, in the Women in Neurosurgery meeting, we actually had an interview with her in front of as a WINS reception, and it was wonderful just to listen to her recollections and thoughts about women in neurosurgery as she advanced to become the first one who was board certified. And the board's been around for 70 years. Or 70, I think it's 75 years now, the American board. So it took a while to get a woman there. Alexa Kennedy is an extremely important person in this timeline because she is the first woman uh, uh, a first African American woman to become a neurosurgeon and then to become a board certified neurosurgeon. She was a pediatric neurosurgeon. She's retired, and she is a great humanitarian, worked in the Children's Hospital of Michigan in Detroit for many, many years. And she is an absolute pioneer. She's a humanitarian and has been honored many, many times for her contributions to the field. So where are we today? Well, as you can see that there's been a rise and it continues to go up where, back in Ruth Jacoby's time, there were very few neurosurgery for women in neurosurgery. And then starting in the 80s, you start to see this kind of more logarithmic or steeper rise in the number of women. So when I was graduating from medical school, and I started neurosurgery roughly around 1990, 1991. You can see where we are in the curve here at this point in time. So there were predecessors. So I sort of came in at a time where we had more neurosurgeons as women, but still we weren't really very high on the list of in proportion to the men. The other thing is that I would say at that time maybe we were about 4% of practicing neurosurgeons. And so, sort of by the time I graduated or into becoming a junior attending, we were up to about 5% of the practicing neurosurgeons. So, over time, this stuff has gotten better in terms of the proportion of women. So some of these stats in 1965, female were represented only 9% of the medical school enrollees. So you got to understand that even now, and so this number is actually written here is a little different. In many medical schools, women comprise over 50%. So it's like 51 or 52% of medical enrollees are women. So it's certainly in medical school, we've seen a huge rise and more equity in terms of the numbers of women and the opportunities that are facing those women. However, in neurosurgery, there's been quite a bit of a lag in keeping up with the general trends of medical enrollees. And when you think of how women, there were medical colleges for women, namely the Medical Women's College, which is now Drexel in Pennsylvania, was one of the first, I guess, legitimate medical schools for women in the 1800s. We now see that that is no longer needed. We're coeducational and comprise a great number of the medical school graduates, but neurosurgery has been lagging. So and a lot. We're not the only surgical subspecialty or subspecialty that lags. The orthopedics, urology, and other such specialties really have much fewer women, but we're getting there. So the question is, what are we doing wrong, or maybe where are the opportunities for improvement here? Because we want to see how we could get more women here, and what are some of the challenges that are facing women for surgical subspecialties such as neurosurgery? Well, there are few women in leadership positions. Now, I know right now, there's, I think, about 6 women chairs in the United States as chairs of academic programs. There are chiefs of neurosurgery in various hospitals that are women, but when we look at leadership positions, we kind of look at it through the lens of academic training programs, because that's where people have influence over the future of neurosurgery, of all the training, all the future neurosurgeons that will be going out there in the field. And so that's why we look at it through that lens. The relative paucity of mentoring is a problem, and because women do not comprise a significant number of faculty members in academic medical centers, it's very difficult for other women to recognize themselves in those programs if you're not seeing someone like you. And that's the way it is in when we're training a lot of people, and even in trying to cover disparities in healthcare. The more diverse the workforce, the more people are able to feel comfortable in relating to doctors that have similar experiences than they do, and understand their experiences or their cultures. And so here, we need more mentors. We need more people visible as women in neurosurgery to then allow more freedom of choice of women coming up to choosing neurosurgeon as a profession and as a career choice within medicine. Um, there is a lack of workplace flexibility and affordable childcare, and this is a problem across the board in the United States. So honestly, there's not much paid parental leave, and so that may be a barrier towards women in trying to achieve, the lives that they want to achieve, to have families, and in addition, be a neurosurgeon. There's a financial disparity. Unfortunately, that's still the case. By and large, in academics and in general, women receive at least 80. Uh, uh, if you look at what a man's salary is, a woman's salary is approximately 80% of that. So there is, we have to get rid of those pay disparities in order to make the field more equitable for women. And this is not just in neurosurgery, it's across the board in medicine in general. And there are antiquated attitudes about the extensive contributions of women in the workforce. And how long has that been going on for? And I put that out as a rhetorical question. So there are few women in nurse leaderships now. The pioneers is Corinne Marasco. She's a neurosurgeon. She trained at Columbia. She's a pediatric neurosurgeon, and interestingly enough, she has worked her whole life with disability. Was born with spina bifida, and was essentially required accommodations, but she rose to the point of being the first chair of neurosurgery at the University of Michigan in Ann Arbor. And a great program, highly reputable program, one of the top programs of neurosurgery. And she became the first woman to chair an academic department in the United States. The second woman is Linda Lau, and she became the first woman to chair the Department of Neurosurgery at UCLA. And she also became, interestingly enough, the first chair of the American Board of Neurological Surgeons, um, or Neurological Surgery. She became the first woman chair of the board. So it was, I think Corinne may have been actually the first woman on the board. Linda became the first chair. So these are more contemporary pioneers. I am happy to say that we do have other women that are now chairing departments. Dr. Marasco has stepped down, and Dr. Lau is still a chair at UCLA. But here, I don't know if you can see my arrow, but maybe I could, my annotation feature here is Dr. Timmons, who is now the chair at Medical College of Wisconsin. Dr. Abosh, who is now the chair at the University of Kansas, and so chair of neurosurgery. And all as these other women are professors, there are a couple of other women chairs. There's Dr. Stacy Wolf, who is now the chair at Wake Forest in North Carolina. And then there's Dr. Ellen Eyre, who's the chair of neurosurgery in Detroit at Henry Ford. And there's Dr. Politzis, who is the chair of neurosurgery at University of Arizona at Tucson. So these are important strides. So now we've blossomed from just one person to now several women. And so women are now becoming, more of, becoming a choice in terms of their leadership capability. But we do have a way to go, for absolute sure. So get rid of this annotation feature. Okay. So interestingly enough, Dr. Timmons is actually now the became the first female president of the American Association of Neurological Surgeons. Now, a little bit of history about the AANS, which is a very important organization. There are two major organizations here. There's a AANS and there's the CNS. And the CNS is the Congress of Neurological Surgeons. The Shelley Timmons became the first neurosurgeon as a female to be the president of the AANS. There was one other female president before, and that was when it was the Harvey Cushing Society back in the late 1930s, and around 1938, Louise Eisenhart was a neuropathologist who worked with Dr. Cushing, and basically she, was so closely aligned that when he developed a society with his name on it that has ultimately become the AANS, she became the president of that society. And so she was able to organize a lot of things. She also actually was the first editor of the Journal of Neurosurgery. So there was female leadership, but not as a neurosurgeon. So she was a neuropathologist. Shelley Timmons is the first female neurosurgeon to head the organization. And I am actually proud to say that as of this fall, a woman will ascend to the presidency of the Congress of Neurological Surgeons in its 75 years now for the Congress of Neurological Surgeons, and the first woman to become president. Yes, it's true. I actually was the first officer of the Congress of Neurological Surgeons, the first woman to become an officer. I attained the rank of vice president, but now finally, then that was a decade ago. So finally, now a decade later, we have a woman who has achieved the presidency of that organization. So they're CNS a few years behind the AANS. Since the AANS, we've had another female president, very important, and we have multiple female officers of that organization. So we're getting there. We're rising in the ranks. We've had not yet a female president. Oh no, I'm sorry. Dr. Marasco was also the first female to be the president of the Society of Neurological Surgeons also. So, and then we've had other societies that there have been female presidents, including the Neurosurgical Society of America. But these are the two main organizations, and the Society of Neurological Surgery actually does have a great influence upon residency education, and that's where its forte is. So happy to say that my colleague Ronit Gilad is not the interim chief of neurosurgery. She actually is now the chief of neurosurgery at Staten Island University Hospital. She actually won a leadership award from Northwell Health as a result of her position there. And she has been expanding our program over at Staten Island, which is a level 1 trauma center, and opening an ICU for neurosurgery and 24/7 neurosurgical PA coverage and faculty recruitment. So a lot of programs under her leadership. So we're looking at a new generation of leaders that are handling departments and expanding programs and making tremendous contributions. So this is me. I'm a professor of neurosurgery. I've been at North Shore University Hospital now for the past 11 years. Before that, I was at Mount Sinai Medical Center. I was a resident there at Mount Sinai, and by the time that I got in there, had been a nice history of women achieving residency positions in Mount Sinai's program. And so when my residency experience was actually a very favorable one, because let's just say everyone was accustomed to having women in the program. And that's not the way it was at my time in other programs. And It's only, I think, in the last couple of years that the last remaining programs that have never had a woman finally have women in there. So I think there's a woman in almost every residency program that we have, but certainly that was not the case when I was a resident back in the 1990s. And so I do a lot of things, but my story is that I graduated from medical school in 89. I actually did not get into neurosurgery right away. I didn't get in out of my senior year, which can happen. If you don't match, you don't match. But I got an internship position, preliminary year at Mount Sinai. I was fortunate to be able to do a month of neurosurgery at Elmhurst Hospital, which is the level one trauma affiliate. And I got to know the residents, I got to know the people there. And I then applied only to one place for the next match, which I wasn't actually going to do. I was going to wait a year, maybe doing some research or what have you. I was encouraged to apply, and I actually then matched at Mount Sinai. So it's a sort of a nice story of making it through when failure to make it in to neurosurgery, but persistence is the key. The persistence is that show up, do a great job, start working hard, and then persist on your dreams, because if you don't do that, then you may not realize your dreams. So opportunities missed are opportunities that weren't taken. And so therefore, if you take those opportunities and you work hard to try to achieve it, then hopefully you'll get what you want. And I did. And so now, all these years later, I'm a neurosurgeon. I'm a full professor at Zucker School of Medicine, and I've been in an academic teaching program for eons since I graduated from residency. I'm not sure I would have it any other way, because I just love having and working with residents as they're rising up over the course of time to become neurosurgeons, and helping raise the future neurosurgeons. Also, there's a lot of mutual teaching too. Residents are eager to learn, but they also know a bit more in terms of how much they read, and then they can also teach us. So it's really a very mutually beneficial environment to be in. So we do have, and I'm just trying to be uh, very, is that since this slideshow has been made, there are, of course, more women, as I described to you earlier, in our program, but we could always do better. We could always improve the number of women by actively recruiting women into the program, because a lot women that are graduating from residency are equally as qualified and deserve equal consideration in terms of positions post-residency. I think the only time, honestly, when women are right now getting equal pay is during residency, because residency salaries are set no matter what your gender is, right? And so, but it's when you get out there, it's learning then how to stand up for yourself, learning how to negotiate. And that's where women don't necessarily get the mentoring that a lot of guys do. So I think that we have. Um, I think that we this is just an example of the financial inequality. So I quoted to you around like 80% salaries, but of course, if you actually look at in general about women in medicine, that actually there is a disparity even among classes and ethnicities and race in women. And so it's very interesting about that. And these are the things that we need to break through in order to improve equity. So we want to, some of the things that can actually hold us back. are in terms of opportunities that are available to us. Oftentimes, women have to be more aggressive in pursuing that than we would naturally potentially feel inclined to be. Sometimes there's a feeling that we have to work more harder than our male colleagues in order to really get the respect and the advancement that we deserve. And that's something, and there's also implicit biases that we're always having to try to combat. And there's also a term called microaggressions, where there are small things that are said that may actually not be that the provider, the one who provides that microaggression, says the silly things that they say that may be not quite right for women or any group that's marginalized. And I would say in neurosurgery, we are definitely a minority and can be marginalized. And so that's why we need to fight. And so we can be sensitive to things like certain microaggressions that other people are not aware that they're providing to us. And so we need to sort of try to fight back and stand up for ourselves. There's also imposter syndrome. Now, women are not the only ones who feel imposter syndrome by any stretch, but it just seem to be amplified with us, that we feel that we are really not qualified enough for our positions. And that's potentially partially in ourselves, but also partially in response to the way women have been historically treated and the implicit biases and maybe some of the overt biases that are still extant in our system. But it's very interesting because there are studies that female physicians actually uh, get better outcomes than men. And this is an example of a study in recent years where the number of female female neurosurgeons actually have a lower hospital mortality and readmission rate, and actually may have a better surgical outcomes because of their relationships with the patients may be different, maybe more maybe more, I don't want to say humanistic, that may not be the right term, but maybe more patient-centered than our male colleagues may tend to be. So it's very interesting about some of these investigations that have shown that. But there is this publication that actually was that we had that the number of U.S. neurosurgeons are actually rising. But the number of people in academic positions and reaching full professors are actually still on the low side. So active ability to recognize and advance women who need to be advanced is very important. And so with that, I'm going to stop sharing the screen and I'm going to open this up to lots of questions. So I am here to answer any of your questions about being a woman in neurosurgery. And I want to just say this prior to opening up the questions, that if you are thinking of neurosurgery as a career, don't please do the research. Please do shadowing. Please investigate. Of course, you're not going to want to do it without, you don't, you should test drive a car before you buy it, okay? Test drive neurosurgery too, because it's not easy. And I'm just going to tell you this right now. It's not an easy profession. It's not easy for work-life balance. It requires many years of training. So we're talking about 7 years of residency, maybe 8 years, including a fellowship, depending on what fellowships you're choosing. And so a lot of people either delay child rearing or childbirth or raising a family until after residency, or they do it during residency, but there are challenges to that and timing that, and so if it is not easy, it's not easy for anyone. It's not easy for male or female but it can be specifically challenging for women because women are not only in society take on the role, their career role, but they're also expected to take on the role of mother and caretaker. And so there's a lot of pressure on women that doesn't necessarily exist for our male colleagues in terms of what societal expectations are and what our own expectations are for ourselves. So with that, I will now start answering questions or having a conversation.
Yeah. So one of our brain turns had asked if there were any particular programs you found that have been supportive of women and or international graduates.
Okay, so we'll take the women first. As I said, I think there are no longer any neurosurgery programs in the entire country, at least allopathic programs, that at least do not have one woman or have had a woman. So, but it still varies on, and some women's experiences may vary depending on how many faculty member are women and what the general attitude of the program is towards women. It's just not cool. Discrimination is not cool. Okay, it's not cool for them, and it's not cool for anyone at this point in time. But that's not to say that this doesn't happen, or there are microaggressions or even biases that occur. So that you would have to investigate if you're at the point where you're looking at programs. Some people are just open to going anywhere, and that maybe that's a good attitude because hey, if I want to be in California, I want to be in Wisconsin or anywhere else in the country or in New York. You're going to investigate those programs, find out more about them, see how many women are actually on faculty and how many women they've actually trained. So if that's the homework that anyone who's applying for a job needs to do anyway. So you want to look towards those things because I think the experience will vary depending upon the history of that program. But I'm not going to disparage any one program because I think all programs have been more open, more accepting of women. So hopefully we're not encountering those difficulties as we're going forward in training. And so let's be optimistic and do the homework. As far as international grads, there's a general, there is for international grads, it's more difficult to get a residency spot in the United States, and especially for neurosurgery, which is very competitive. All right, so for 100 and what, almost 140 slots, we've got what, maybe 400 or applicants overall, and I think that's so there is a significant competitive um, statistically for these spots. So it makes the chances for an international grad a little more challenging. Okay, so an international grad is going to probably have to look into doing other things, research opportunities in the U.S. at various programs. Try to get in through other channels to get experiences than before actually applying through the matches. So I think that that's a challenge in and of itself, that whether you're a man or a woman, it's going to be challenging.
For sure. We've kind of
But
talked
not
about,
doable, but not undoable, sorry, not undoable. And so that requires persistence, that requires, but it also requires a degree of open-mindedness and flexibility in order to achieve that.
yeah, for sure. So we've kind of talked about, different things that you can experience, like maybe microaggressions, kind of seeing the discrepancy between male and female, whether that be wages or maybe just experiences. So I think a great question, for you to answer would kind of be, how do you go about dealing with those situations or having those conversations? Especially, I think when you're a little bit earlier in your career or training, how would you advise our brain turns who may experience those things to go about a situation where they do feel like they've experienced whether like a microaggression or it's just very apparent in, I guess, the discrimination.
So the I would love to say very easily that it's easy to stand up to those things, but it's not because there's also the hierarchical concerns where, all right, if I'm making waves, what does that mean for me and my career, you know? And but there are methods to try to gently remind people, hey, that's something that I'm not necessarily appreciative of. You could do that, but there are avenues within each school that allow people to wage complaints, especially if something there's overt or significant, to a specific officer, ombudsman person who actually is supposed to listen to all of that and then take action. So there are ways of file, but if you're not comfortable with filing it with your own residency program director, which you should be more comfortable doing, and I could say over what I'm observing in academic neurosurgery that there is a trend towards a lot of women becoming residency program directors. So that's helpful to women, so that you have a sympathetic ear in as the residency program director. But not every residency program director has a woman, is a woman, right? So, but there are avenues to lodge complaints. The other thing with microaggressions, and I hate to say it, but the thing is sometimes people joke. And the jokes may not necessarily be appropriate. You just have to decide for yourself, is this person really being malicious or are they not? So is it something I can just let roll off my back and just continue on? Or is it really something that's significant that I have to make mention of it? So those are the social and ways of trying to figure out what's meaningful and what impacts your education. If it's impacting your education, if it's creating distress, then that has to be addressed. And there are channels to address that. So even if you're not going to directly say anything to that person because you're concerned or you feel that it's difficult to do so and to have that difficult conversation, there are avenues to have to to make people aware.
Yeah. So we have another question that says, if you're accepted into a program where there hasn't been a long history of women, what advice would you give to someone who's essentially a pioneer? How can they navigate that space and still make their mark while staying true to themselves?
Um, okay, yeah, I see. I was looking at the question now. Um, so that's interesting. So let me just say, all right. I think the what you actually in your question is what's really important. It's being true to yourself. If your work ethic is there, you give 110% of yourself in a program, ultimately that's people are going to notice that, okay? And in the residency program. And I think that that's something that you may feel like you're a pioneer, but and you are probably if you're like one of the few women there, or maybe the first woman in that program. But be true to your own work ethic. Be true to how you function and what you feel is the right thing to do. And as a result, over time, that's going to get noticed. Okay. Um, Everybody has to put in the same amount of work, honestly, as a resident. You have to give more than 100% of yourself in residency. You have to go that extra mile for your patients. You have to read a lot, okay? And you have to try to do well on written board exam and the anatomy exam and other whatever other um, didactics and sessions that you have to do your best. And no matter who you are, so you need to just do that. And that's, I think, the best way is to really to demonstrate. Now, it may feel like, oh, gee, I think I have to work harder than anyone else. I think in residency, everyone has to work equally as hard. And it may feel like, oh, and for me to get noticed, I have to work harder. You know what? Everyone's going to need to work equally that hard. So try not to feel, and it's easy to let perceptions get the better of ourselves. That doesn't mean that what we're perceiving may not actually be true, all right, in terms of how people are reacting to us. But we have to just go forward. And then, as per the previous discussion, if there are problems, then they have to be addressed. The thing is, I walked into my current job. I actually was the first woman, uh, not the first woman as the academic program existed at that time. And I was the only woman neurosurgeon in that group. And I just walked in doing what I do. Okay. I was, I guess, the pioneer for that program, even though I hadn't had that experience before. But all you have to do is I just was myself. All right. And I just did all the things that I had to do. And I'm not saying that there aren't challenges. There always are challenges. But that's how I was. I was true to myself.
Yeah, there's a lot of questions asking about what was the hardest challenge for you to overcome, and how did you do that and stay resilient?
Well, the hardest challenge that I had to overcome was not matching into neurosurgery the first time out of my last year of medical school. And that's usually the majority of people match the first year. We had an early match at the time. It was a January match. It was the San Francisco match. And so then they converted it to the ACGME general match in March, which actually gave me enough time to actually go into plan B. So then I set up my surgery preliminary because I felt like my choice at that time was like, well, I think I'm going to have to show them how good I am clinically before I get another position or try again. And so that was my choice. And so I had to plan, and it gave me an opportunity to do that. But I have to say, it was devastating. I was completely devastated. But, going into, you know, and I think I was depressed actually for a period of time. But I had to say, well, now, but I didn't have time to say, well, I don't know what I'm going to do. You have to put that plan B in action. You have to think, well, what if I don't make it in? And then you have to do plan B. Okay. And resilience is just a matter of trying to pick yourself up and getting back into the game. And that's how I was resilient, is I picked myself up and got back into the game. But what actually was more challenging about this particular thing is that I actually had a health challenge and I actually needed surgery. And the surgery occurred like the day after the match results came out. So you can imagine I'm going into surgery with this stressor, with this bad news. And so that was even more challenging. How do I actually recover from surgery and then become resilient and do the rest of this? So yes, this was the most challenging part of my life. But I got in and I'm here. So, and I'm still here. So I'm glad. And I think that I've done a few things over the course of time, in my work and on the national front. I'm right now currently on the American Board of Neurological Surgeons, so I'm a director on the board. So that's a very fulfilling position, a lot of hard work. So I'm here. I'm a testament to persistence and resilience, if that's the definition of that.
Yeah, thank you so much for sharing that too, because I feel like a lot of the times people, believe that there's just one linear path to get to where they want to be, which isn't true. Everybody has a different path and different experience. But I guess going along that, we've obviously, with neurosurgery being such a demanding specialty, or one of them, a lot of questions we're getting is how do you manage and balance that personal and professional life as, especially as women, it can sometimes feel like you're choosing a career over a family or, trying to f figure out what that balance is.
So that's that's probably the biggest challenge is well, one of the biggest challenges. I mean, I'll talk about everyday challenges is decision making, patient care, trying to do the best you can for patients and that kind of life and death stuff, that's challenging. Okay. So that's one aspect of professional challenge. Other professional challenge is advancement. But then there's the life challenge, which is raising a family. And I have to say that I actually really delayed everything. I delayed everything. Include by the time I got out of residency, it's like, oh my God, I've delayed everything. I said, well, maybe I should just start trying to, get a life. So I ended up getting, ultimately finding finding someone, a husband. I married that person, and we had one child. And I was a little late on the child. I have to say that, and I thought that, hey, look, I have time. Look, I think well, it was challenging to get pregnant, and ultimately I had to do in vitro fertilization. Thank God I have this gorgeous daughter who's just graduated from high school, going to college next in the fall. But that was challenging too, and so then of course having enough support at home to be able to do what I do, and also have the support and raising a child. So when there's no shame in help, whether it's a family member helping you versus a hired nanny or an au pair. There is no shame in this. These are methods of getting raising a family, having that legacy, having a child, being able to have that loving environment, but and do your work at the same time. So there is that option, but there's a little extra work that goes with it, and trying to find a support network. It just so happens my husband was an attorney, and he decided to retire from that job and become a stay-at-home dad after like 5 years of having a nanny, which was actually a good thing. And so I think that we have to rethink, the whole family dynamic. We have to think about, what is traditional family versus what are the modern family. And certainly the neurosurgeon, a woman neurosurgeon is a, a demonstration of what modern family life is like. Okay, it's not traditional, but it's a family. It's challenging, but it's also very rewarding. So you can have everything. You just have to find out how, you just have to create that everything. And I'm not saying it's easy. It's never easy. And that balance, is not balanced actually. But there are ways to try to create more balance. So that's a discussion, I guess, for another time.
Yeah,
Why neurosurgery? I guess I got 2 minutes left. I see that question. Why did I choose neurosurgery? I was waiting for medical school because I was a good student, but I don't know, my grade point average wasn't quite. It was a very challenging year for medical school graduations, and I did really well in college, but I still was on the waiting list for medical school, and I finally got in. But during that time in the summer between medical school I mean, college and medical school, I actually started watching this program called Ben Casey, which was on at 3 o'clock in the morning. So I recorded it, and I was able to watch it. And it's about a chief resident in the 1960s at, I guess, Los Angeles County Medical Center, and it's like a 5 years of him being a chief resident. But it was fairly accurate for the time. And actually, I said, "This is so cool. What is this neurosurgery?" So obviously, I'm not going to go into neurosurgery on the basis of a TV program or a TV, but I had a TV mentor. I really did. And so I decided to investigate it, and then the rest is history. And I told you the other history. So why did I choose it? Because I saw a TV show that showed it, and it was so fascinating that it got me into it. And I'm not the only one that was influenced by Ben Casey. Dr. Oishiku, who was the editor in chief, and he's a chair of neurosurgery in Chapel Hill. He also put the symbols of Ben Casey. If you want to Google it, put it on YouTube, you'll see it on the cover of the Red Journal, because he also was influenced by Ben Casey to become a neurosurgeon. So it's not just me. So it's great. Anyway, I think we have to wrap up. There's another program. So
Thank you so much, Dr. Ullman, just for coming today again, just and for your presentation. I know everybody learned a lot. So thank you so much. And Brain Turns, if you can just say thank you to Dr. Ullman for joining us today.
thank you for having me, and it was really a pleasure. You could always reach out if you have any other questions or